today we're going to talk about different types of meditation and mindfulness exercises.
All right.
We've mentioned all week long that there are a multitude of benefits that come from meditation practices and using different forms of mindfulness exercises. Right. And we spoke the other day about major changes that can happen in your brain, very measurable changes that can happen in your brain after a short time of employing some of these practices. And so today we're going to talk a little bit about some different forms of meditation and mindfulness so that you can find the one that is best suited for your needs.
That's right. When this topic comes up, typically when you mention this to people, they get sort of squeamish because and most people respond the same. Oh, no, that's all that hippie, touchy-feely stuff, and it makes them very uncomfortable. Right. And that's a common response.
And some people are hesitant about it for religious purposes.
And there's the religious aspect of it, because this is the whole concept of meditation is born of religious practices. It comes out of religious practices in the Far East, India, so it is based on religious experience. And so you're right. For some people, this is perilously close to their religious beliefs, and that they want to avoid it for that reason. Most of us, however, just react because the whole concept of meditation is relatively new in the United States. It's here in the 20th century, when it was introduced here. And if you remember the Beatles, they had that little period where they were going to India. And that's when most of us really discovered it. Was because of that during the 60s. And so it's always been associated with that hippie generation, the 60s generation. It's far more than that. And we've learned that it's far more useful than that, because not only do we now know that you get immediate relief of stressful situations to relieve acute stress, but that actually if you practice this on a regular basis, you can get long-term and what we called yesterday trait changes. So not only change your current state of being, but you can create long-term trait-like changes in your brain. And we compared it to medication effects, which have long-term medication effects. So this can have the same thing. But what you have to do is, since this was introduced in the United States, there are dozens of ways to meditate. And what the challenge is to find the one that works best for you. And that's what we want to talk about today. What's going to work for you? So don't be embarrassed to use it, and then find the one that works best.
We're pulling information from two different articles, both of which are from Medical News Today. The link to both of these articles are in the show notes. One of them presents 7 different forms of meditation, and the other includes 6 different types of mindfulness, 6 different mindfulness exercises. There's a lot of overlap between the two lists, and so we're going to hit some of the highlight some of the big points here.
And the other thing with these meditation techniques is that they are comparable to some of the techniques we use generally. We don't call them meditation. We call it cognitive behavioral therapy. But much of cognitive behavioral therapy is based on meditation. The other one that many people will be familiar with is the Lamaze childbirth method, which uses breathing exercises, which come out of the whole area of meditation. So you may have used some of these techniques and not really known it.
Absolutely. So, all right. So let's talk about some of the different types of meditation. One of them is called Lovingkindness meditation, and now we're starting with this one. Though this is going to be one that is going to immediately take you back to that 60s stereotype of meditation.
It does.
But the whole idea here is to open yourself to the opportunity to experience kindness and love from other people.
And when you read about this, it's like, oh, here we go again. And that's what it does. It just, oh my God, I don't want to do this. That you're going to be loving and you're going to give love to the universe and you're going to receive love from, and that's the kind of language that turns many people off. But that's not quite what this is about.
Because this is, this type of meditation is especially good for people who harbor a lot of anger, a lot of frustration, a lot of resentment, and those kinds of things, because those emotions, those feelings block or inhibit our opportunities to have positive relationships with other people. So this kind of meditation actually can be very helpful for those individuals.
That's right. This is great for people who tend to look at everything as the glass half empty.
Right.
Okay, that they have angry thoughts, that everything bothers them, they're easily irritated, and what you want to do is you want to replace those negative thoughts with more positive thoughts.
Right.
That's essentially what you're doing
Absolutely.
here. And so they talk about love, but it's just looking at things a little bit differently. That's all you're asking for here.
Now, a second type is called body scan or progressive relaxation. And what this is again, this is a very common practice whereby you sort of sit quietly and just kind of walk your way through your body and look for areas that are high in tension or that's holding a lot of stress. We mentioned this a couple of weeks ago that people sometimes who experience stress will feel it in their shoulders because there's a lot of tension and the muscles just get very tight and bound there. And so that's a very good strategy to use. This is a very good strategy to use when you're holding tension in different parts of your body, characterized by just muscle soreness or just some limited mobility and that kind of stuff that's coming from stress.
I have to say that I don't have a great deal of experience with these different techniques, but this is one that I did. I didn't do it. I took a course when I was in graduate school, very early in my graduate training, and the guy's name was Bill Cormier, and he and his wife had written a book about counseling strategies, and I took a course that he taught. And he did this with our whole class. He had us form into dyads. And he walked us through. He turned the lights down in the room, and he walked us through this. And I'll tell you what, I have never felt more relaxed in my life. I had to have a shot of some drug because I was having a breathing spasm, bronchitis or something. I don't know what it was, Valium or something. And it was comparable to Valium. Okay, it was that profound, because what he did is he did a body scan. We went all the way down from our eyes all the way down to our feet. And when I was done with that, it took about, I don't know, maybe 10, 15 minutes. The only thing I can compare it to is a shot of Valium. So if all of the techniques work as well as this one, it makes you a believer.
Right. Now, the third one mentioned is mindfulness meditation, and we're going to spend more time talking about that one in just a moment, so I'm going to put that one aside.
Yeah, and we've talked about that before.
Yeah, we've talked about it a few times.
But we're going to talk about it again when we do the 6, right?
Right. Now, the fourth one is breath awareness meditation, and just like what we were just talking about with scanning the body for muscle tension and things like that, this meditation expects you or requires you or encourages you to really focus on your breathing and focus on taking deep breaths and relaxing the way that you're breathing, because when we're stressed, when we're anxious, we tend to breathe faster, more shallow, and so this is one that encourages us to take more deep breaths.
And again, what you're doing is it's always about replacement. You're replacing negative thoughts with thoughts about your breathing. Okay, because breathing is neutral. There's no good or bad in breathing. So what you're doing is you're moving your thinking from the irritating, stress-inducing, frustrating, anger-producing thoughts that many of us have to something that's neutral. And once you relieve your brain of all that, the worry circuit in your brain starts to come back to normal. Because what happens, you get these thoughts, and they increase, they continue, and they get worse. Okay, the more you think about it, the angrier you get, and we've all had that experience. So this shuts down those thoughts by moving them to something else. Your breath, which is neutral.
Now, number 5 is one that I had not heard of before.
I haven't
and
either.
This is called Kundalini Yoga. I think that's how you pronounce it. Kundalini Yoga, and so this is a mixture of yoga movements and postures with deep breathing and mantra-like meditation.
Yeah, so what you're doing here is you're getting a double benefit. The movements increase your strength, and this is particularly useful for people who are of limited strength and the elderly or injured, post-surgical recuperation. So people who begin with a weak muscle system. And so you get increased strength, but also stress relief. So it combines the two. I might look that one up. Yeah. See what that. I think of Tai Chi when I think of this, but I'll have to look it up and see, because I don't know anything about it either.
Now the next is Zen Meditation. And Zen Meditation is, this is the one that's rooted in the Buddhist tradition.
This is the one that we always think about and the comedians talk about and all that.
Yeah, so this is one where you're just working to get in a comfortable position, focus on your breathing, and just sort of mindfully observe, sort of your thoughts and your judgments and your perspectives on things that's happening to you.
Right, and of the 7, this is the one where you, which is typically done with an instructor, because there are certain steps and procedures that you use for Zen meditation. So typically you have to learn those from somebody else. You don't have to. There's a way of doing it without that. You can teach them to yourself. But this is typically the one where you have a master teaching you. What was that? Kung Fu years ago. David Carradine was in that TV show. And that's what this Zen meditation is. But again, it's the same idea. Is you're moving, you're doing all these things which replace the negative thinking.
The last one mentioned here is Transcendental Meditation. And again, this is one that became very popular, or at least commonly talked about, because there's some famous actors and musicians and artists that practice Transcendental Meditation. And what this is this is sort of a more spiritual type of meditation. Right.
I remember when this swept.
Why are you throwing stuff around?
I don't know. Just this. I remember when this swept through the country in the 70s. Do you remember the 70s? Or anything all about them?
Kindergarten.
Okay, well, when you were in kindergarten, this swept through the country, and I remember not everybody, but everybody was talking about TM. And there were classes and things, and people were doing TM. And this is the one where we just rolled our eyes when people would talk about TM. Oh, here we go again. The hippies from the 60s are now doing Transcendental Meditation. But again, as the word implies, you transcend, you move beyond your current thinking. And that's what all of them are about. Okay, so this is not any different. But what transcendental means is you transcend your current negative thoughts and elevate them to some other place.
Absolutely. Now, if we shift over to the other article, are you having asthma?
Here's what happens. He makes me laugh in the morning. Okay, we get in here, and he starts. Okay, so I'm not going to take full responsibility for this, and yes, I will blame somebody else. He makes me laugh, and when I laugh, I have asthma. I have exercise-induced asthma.
So you're laughing as an exercise.
And when you start these things that you do in the morning, I start to laugh, and then it triggers a little bit of this exercise-induced asthma. So I apologize for that, and I'll bring an inhaler. But if you would encourage Dr. Berney to stop these little introductory little things that he does in the morning, it would help all of us, especially my lungs.
I genuinely have no idea what you're talking about.
I didn't think you would, but we can transcend this and move on. So it is his fault, just so you know.
I would be happy to take the blame for anything that I understood that I was doing wrong. But
and I won't even tell you what he talks about in the morning because it's not family. What do they call it? Family. What are those video games? They have family. What are they called?
Go ahead.
Teenagers, mature only.
Richard, I really.
So,
on to shift over to the other article.
Now, I have to say though, these are 6 mindfulness techniques to try today for physicians.
Right.
Okay, because much of when we looked this up, it was in medical journals and medical newspapers, and so this was 6 for physicians. By no means should this be limited to physicians.
Absolutely.
I mean, they address the needs of physicians because of their unique situations, but these 6 would be useful for anybody. So when we read through them, we said, well, wait a minute, anybody could use these.
Right.
So although it was written for physicians, and we'll refer to physicians as we talk about these things, they can be applied anywhere by anybody.
Right. And a couple of these are very similar to the ones we just talked about. And so the first one is taking a pause in breathing.
Right.
So it's very similar to that breathing relaxation that we talked about just a moment ago. And this is, as you're feeling stressed and overwhelmed, taking that moment to pause and just to step back and focus on your breathing for a few minutes so that you can sort of relieve some of that stress.
Right. And he has a wonderful little a way to remember this. It's sort of like this mnemonic device. He calls it the doorknob technique. And he said he's talking to physicians, and you can imagine a physician either going into surgery or just coming out or has difficult cases, and you reach for a doorknob. Now, frequently you can reach for a doorknob and rip the door open, which increases your stress and your anger. But he said you can also reach for the doorknob and pass your stress to the doorknob and to the door.
Right.
Just stop for that moment when you're reaching for the doorknob and think about just pause. Pause and get rid of that stress through the doorknob. He said it only takes a few seconds. So again, you don't have to sit in a yoga pose to do this stuff. You can do it on the fly. You can do it while you're moving. And that's a good one to remember.
Right.
Pass it on to something else.
The second one mentioned is mindfulness meditation.
Right.
And again, so as you said before, we've kind of talked about this previously this week, but this is a taking a moment to stop and to maybe sit in a quiet place or to follow a guided meditation or something, and just becoming keenly aware of where you are at that moment, aware of your body, aware of your surroundings, and just bringing yourself into the moment instead of focusing on the future, focusing on past events, just focusing on right now.
That's the important point, is that when we fret, when we get angry, invariably we're angry about something that happened in the past, or we're worried about something in the future.
Right.
And when we talk about getting to the present, what we're saying is get rid of these anger-producing thoughts from your past. You really can't do anything about them, okay? Get rid of that. But it's hard to forget about the past. They nag at you, okay?
Right.
So instead of spending time worrying about those and letting them nag you, come to the present and the past will start to disappear. Come to the present and you'll be thinking about the present regardless of what you're doing. You'll be brushing your teeth.
Right.
But you're not worried. If you're thinking about brushing your teeth, you can't also think about the future.
Right.
And so we're not talking about the present. We're talking about get rid of the past, don't worry about the future.
Right. The third one is awareness of feelings and thoughts. And again, much like what we were just talking about, this is taking a moment and just being cognizant of what you're thinking about, cognizant of what you're feeling at that moment, so that you can let those things pass by, that you can let those things go, instead of ruminating over them or perseverating over and over and over again as you kind of go through some of those thoughts, letting them pass through and move on so that you can focus on where you are.
One of the little helpful hints is as you think about thoughts as clouds, and they just sort of drift by.
Right.
Okay, let them go. Let them drift by.
Right. The next is find your feet.
Find your feet.
Now this one again is very similar to that body scan, and actually number 6 on this list is body scan.
Right.
So this is these two are very similar to what we were talking about with the meditation, where you're actually becoming aware of your body. The one is being more specific to your feet, but the other is scanning through your body, looking for those places of tension. In mindfulness, we're going to scan our body and just sort of be cognizant of our body, be cognizant of where we are in space and sort of what is happening to our body, how our body feels at that particular moment.
Right. I like this find your feet thing. I'd never thought about it before, but public speakers are trained to do this, and I'm sure actors are as well.
Sure.
Is that it sort of grounds you, it makes you think about where you are rather than all these other thoughts that come tumbling into your head out of nowhere.
Yep. So the last one here then is make ordinary tasks extraordinary.
I'm going to start doing this one.
Yeah? Okay.
Remember one day I told you I came in here on a Saturday morning. We were going to record on a Saturday morning, and there was a woman on who was talking about drawing with your non-dominant hand, and if you do it, you get insights and it produces thoughts because you're stimulating parts of your brain that you typically don't stimulate.
Yeah.
I thought about that when I read this one, but also he's right. If I brush my teeth with my left hand, that becomes an effortful process that I have to focus on. That means my head is clearing out all the debris. Okay, for that time, I'm clearing out my head of all the distraction, of all the noise.
Right. Yeah, I used to work with a guy. Well, we both worked with Wade. Dr. Myers.
Did you do that?
He used to. I would go into his office and he would have his mouse on the left side of his computer. And what he would do is he would switch back and forth so that he just to exercise that, using both hands and balancing things. Yeah, it was really, It's really cool. So, but yeah,
Try that too.
doing ordinary things in an
Make ordinary things extraordinary.
Yeah.
Again, because two benefits. One is you're stimulating parts of your brain that you typically don't stimulate.
Right.
I rarely use my left hand.
Right.
I'm very right dominant. But you're also, so you're stimulating parts of the brain, but in focusing on this, you're clearing out the noise, you're clearing out the debris. That's what most of this is about.
Absolutely.
Okay?
Absolutely.
So I think it's good advice.
Yep. So check out these two articles. Again, the link is in the show notes for both articles. Read them. Try some of these different things. Tomorrow we're going to talk about different apps that that are available that you can use for meditation and for managing some of these things.
And some of the people we work with are using those apps.
Absolutely.
And we're getting pretty positive feedback.
Yep.
They're saying that they really work well and they really help them do this.
Yeah.
So you may want to take a look at those too. So
Absolutely.
Stay tuned tomorrow.
All right. Until then, stay happy, stay healthy, and forget to be afraid.